If you're someone who was told you need a statin for your cholesterol and you want to understand what those medications might be doing inside your body, not just lowering a number, but affecting your energy, your brain, and your muscles, and why so many patients still don't feel well despite good labs, I want to walk you through this based on patterns I've seen over years of clinical experience, because this matters now before you simply stay on a medication long term without fully understanding the trade-offs. And the question is, what are we missing? Hi, I'm Dr. Bloem. I'm a holistic and integrative physician, and I help patients who are dealing with complex chronic health issues, people who've often seen multiple doctors and still don't feel well. If that sounds like you, make sure you like this video, subscribe to the channel, and sign up for my newsletter. And as you're listening, I'd really like to hear your experience, so feel free to leave a comment below. Let's talk about why this topic matters more than most people realize. Most people are told something very simple. Your cholesterol is high, statins lower cholesterol reduces risk. And that sounds logical, but what's often missing is a deeper conversation about what cholesterol actually does in the body and what happens when we interfere with that system. Cholesterol is not just something that clogs arteries. It's part of your cell membranes. It's a building block for hormones, and it plays a role in brain function. So when we lower cholesterol, we're not just lowering a number, we're influencing multiple systems at once. And this is where many patients start to feel confused, because their labs improve, but they don't feel better. Sometimes they feel worse, and no one connects the dots. Over the years, I've seen a pattern. Patients come in with fatigue that didn't exist before, muscle pain that seems unexplained, and brain fog that gradually crept in. And when you go back in the timeline, very often there's one event that stands out. That's when I started my statin. Now I want to be very clear. This is not about saying statins are good or bad. This is about understanding what they do and how that interacts with your biology. Because once you understand that, the conversation becomes much more intelligent. Let's go a little deeper. Statins work by blocking an enzyme in the liver called HMG-CoA reductase. That enzyme is involved in cholesterol production, but is also involved in producing other important compounds. One of them is something called coenzyme Q10. CoQ10 is critical for mitochondrial function, and your mitochondria are responsible for producing energy. So when coenzyme Q10 drops, energy production drops. And that's where patients often begin to notice fatigue. Not dramatic at first, just a little less energy and a little more effort to do the same things. And over time, it becomes their new normal. Now let's talk about muscles. Muscle pain is one of the most commonly reported side effects of statins. But here's what's interesting. It's often dismissed. Patients are told that's not related, or it's just aging. But when you understand the mechanism, reduced mitochondrial energy and reduced CoQ10, it starts to make sense. Muscles are energy-dependent tissue. When energy production drops, muscles don't function the same way. They become more prone to soreness, weakness, and slower recovery. And I've seen patients who stopped exercising, not because they wanted to, but because it just didn't feel right anymore. Then there's the brain. The brain is highly cholesterol dependent. It uses cholesterol for synapse formation, communication between neurons, and overall cognitive function. So when cholesterol metabolism changes, some patients begin to notice subtle cognitive changes, word finding issues, slower thinking, and a sense of not being as sharp. Again, not everyone, but enough that it's a pattern. And when you hear the same story enough times, you start paying attention differently. Let me give you a patient story. A man in his late 50s, successful, sharp, very active. He was started on a statin after a routine lab showed elevated LDL. Within a few months, he began noticing fatigue, then muscle soreness, and then something that concerned him even more. He felt mentally slower. He told me, "I can still do my job, but it takes more effort." No one had connected this to the medication. His labs looked better. So from a conventional standpoint, everything was working. But from his perspective, he didn't feel like himself anymore. We didn't just stop the statin blindly. We stepped back. We looked at his overall cardiovascular risk, his inflammation markers, and his metabolic health. And we created a more nuanced plan. Over time, as we adjusted his approach, his energy improved, his clarity returned, And most importantly, he felt like himself again. This is where clinical interpretation becomes important, because medicine is not just about numbers. It's about patterns. It's about how systems interact. And it's about listening carefully when patients tell you something has changed. Now, who does this apply to? If you're on a statin and you feel completely fine, this may not apply to you. And that's important, because not every patient experiences side effects. But if you have a very high cardiovascular risk, a statin may be an appropriate part of your care. But if you started a statin and since then you've noticed fatigue, muscle pain, or changes in your mental clarity, this is worth exploring. Not assuming, exploring, and doing that in a thoughtful, individualized way. And there's nuance here. Sometimes it's not the statin alone. It's the interaction between the statin and other factors. Nutrient deficiencies, mitochondrial stress, inflammation, and hormonal imbalance. This is where a systems-based approach becomes valuable, because you're not just asking, is this drug lowering cholesterol? You're asking, what is this doing to the whole person? And this is where many patients feel dismissed, because their experience doesn't match the textbook. And when that happens, they stop trusting their own body. They stop asking questions, and they assume this is just how life is now. It doesn't have to be that way. There is room for a more thoughtful conversation. So here's the takeaway. Statins can be helpful for certain patients, but they are not neutral. They affect multiple systems. And if something changes in how you feel after starting one, that deserves attention, not dismissal. And I'll leave you with a few questions. Has anyone ever explained statins to you this way? If you've taken a statin, did you notice any changes, good or bad, that no one connected at the time? And would you want me to go deeper into how to evaluate cardiovascular risk beyond just cholesterol? I'm curious what your experience has been.